Good afternoon. We're a little late in starting, but I would like to get us started now. My name's Dave Coghill. I'm chairing this afternoon's session. As you'll see, the title of this symposium, Satellite Symposium, Developments and Directions in ADHD, Sharing Knowledge and Ideas Across Europe. And we're very lucky to have with us a wide range of very excellent and experienced speakers. I'll introduce the program to you in just a minute. One thing I'd like just to apologize for at the very beginning is there is actually a booklet, a program booklet. Unfortunately, we've not been allowed by the organisers to give this out prior to the meeting, and you'll have to collect one afterwards. So I'm assured you are able to get a copy of the symposium program to take away with you. The objectives of our symposium are to discuss the importance of a full-day treatment in improving treatment confidence, social integration, quality of life, and the development of social and emotional competencies during the entire day. Also, to review the evidence-based guidelines for the use of long-acting medications in ADHD, to introduce and discuss the findings from a new survey a European survey of parents' attitudes to ADHD and thoughts about their child's difficulties and treatments, and to discuss some more holistic approaches to improving outcomes in ADHD through school-based interventions. And the program for the meeting is that we're going to start off with a presentation from Jan Butelaar on the impact of ADHD on the patient and their family, and the results of a new survey carried out across Europe. We then have two discussants, Andrea Bilbo and Miriam Menter from the UK and Germany respectively, who are representatives of the advocacy groups in their particular countries, and speaking really on behalf of advocacy groups across Europe today. I shall then be making a presentation looking at some of the clinical guidelines for the use of long-acting pharmacotherapy and some of the implications that arise from them. And Professor Paul Cooper will then present to us a presentation on approaches to supporting the academic success for children with ADHD. Just some general housekeeping. Unfortunately, the first part of this is now no longer relevant. The question cards are in the symposium booklets, and as we haven't been able to give you the symposium booklets, you don't have the question cards. We therefore will have to revert to questions as usual, but it is very important, if you are going to ask a question, to at the appropriate points line up behind the microphones rather than just put your hand up, because it's important for everybody to be able to hear those questions. CME accreditation for the European Union doctors and many other European countries. Obviously you're encouraged to participate in continuing professional education, but we don't have certificates for that. But we do have the EACCME in CNS accreditation for this, and you can use this as an accreditation for that program. We've got, on the accreditation, a maximum of 3 credits for attendance at the scientific sessions. And if you're interested in obtaining the credits, then you need to fill in a special feedback rating form, which is there, I think, in the symposium booklet for you to feed in. And also, to get a certificate of CMA credits, the completed form then needs to be sent back to the EACIC Secretariat. And lastly, we will have for you a CD-ROM of the presentations that you're going to hear today. Again, unfortunately, we're not able to give those out at the symposium, but they will be mailed to you following the symposium if you fill in the request form in the back of the abstract book, which you'll get at the end. So you can see not giving you the abstract book actually has made this a lot more complicated than it normally would. I apologise for that, but it is out with our abilities to do anything about that. So I'd like to move on and welcome our first speaker, Professor Jan Buitelaar, who's Professor of Psychiatry and Child and Adolescent Psychiatry at Reboud University, Nijmegen Medical Center, and Head of Department of Psychiatry and Child and Adolescent Psychiatry there. Jan has been well known to me for many years, and many of you will be familiar with his publications. He's had a long-standing research and clinical interest in neuropsychiatric disorders across the lifespan, including ADHD, autism, and has also been involved in many epidemiological, neuroimaging, psychopharmacological and genetic studies. He's editor-in-chief for the European Child and Adolescent Psychiatry Journal and has a very strong publication record behind him. So I'd like to welcome Jan to the podium to discuss the impact of ADHD on the patient and family, the results from a new survey.